Welcome to DogTalk360 Ask a Vet podcast. In collaboration with the George Animal Hospital, our main aim of these educational sessions are the wellness of your dog, and we will cover a variety of relevant topics applicable to all dog breeds, ranging from habits and behaviors, fitness and exercise, vaccinations and parasite control, to chronic disease and other chronic conditions.
Hello everyone and welcome back. This is the fourth episode of the podcast and I'm your host Dr. Christian Blichnout from the George Animal Hospital. Today we will be discussing lumps and bumps. So first of all, let's define lumps and bumps just to make it a bit easier to follow. So this will include every lump and bump that you can think of that can appear on a dog's skin. It can have a range of things. It can be something from growths, abscesses, cysts, swelling due to trauma, insect bites, etc. So we just call it lumps and bumps to make it easier as a starting point, and the diagnosis will obviously follow later. For the focus of this episode, we are going to work towards neoplastic or cancerous growths and to diagnose these in time so your pet can be helped and cured. So first of all, if you discover any form of a lump or bump on your pet, it's important to have it checked out by your veterinarian. So you'll go to the vet, and then the vet will consider a few factors or ask you a few questions. So it's important to observe this lump or knob or whatever it is and make sure that you can answer the following questions. So the first thing is, how long has this lump been on your animal? Now this is important because it will help with the diagnosis and to decide what type of treatment or approach it needs to cure or to resolve or to diagnose the lump. Another thing that your vet will ask is if it grew rapidly, or did it spread from one side to another side? Is it warm to the touch? Is it red? Does it bleed? Does it bother your dog? All these questions will help the vet to decide how important it is to get rid of this lump or how severe the condition or the underlying issue might be. So anything that appears quickly, irritates the dog, bleeds, is painful, grows rapidly, spreads, those are the nasties. So that is why a vet will focus on these factors to decide on what route to take from this point forward. Another thing that will be considered is the animal's age. So the older the pet is, the more likely it is to develop growths like cancerous growths, for instance. A younger pet is more likely to have abscesses or traumatic swellings or stuff like this. So then after the initial assessment, the vet will most likely do a fine needle aspirate if he can't diagnose the lump or the bump just by looking at it and by the history that he gathered. So what a fine needle aspirate is basically using a fine needle and a syringe to draw some fluid or some tissue cells from this lump, and then the vet will check this fluid or this tissue cells that is gathered under the microscope, and he'll look for certain types of cells to try and make a diagnosis and decide what type of lump it is. So things that your vet might find under the microscope is white blood cells. For instance, white blood cells in a lump might indicate inflammation or maybe an infection. This could indicate that it's possibly an abscess or an insect bite, and it could even be a cancerous growth. So depending on the amount of white blood cells, your vet might be able to make a call on what he finds. The next thing that could indicate the consistency of the lump is fat cells. So if there's fat cells in the tissue sample, it more than likely indicates that this is a lipoma, or basically just a fat cell growth. And these are benign growths that doesn't cause any harm, and you see it a lot in overweight patients or in older patients. So that is the second thing that your vet might see. The third group of cells that he might see is round cells. Now, these are the baddies, the ones that you don't want to see. And it's likely to be a neoplastic or cancerous growth if the round cells are present. And the 5 main classes of cancerous growths or growths that can be diagnosed when round cells are present is your mast cell tumors, histiocytomas, lymphomas, melanomas, and TVT. I'm not going to go into detail about these growths, but basically just know that if there's round cells, then normally it's a possibility that there's a malignant growth, and these are the type of guys that the vet will want to take care of as soon as possible. And the third thing, or the fourth thing that the vet will look for is there a mitotic index or neoplastic signs. Now, these are a lot of signs, and I'm not going to go into detail again, but there's a lot of signs that can indicate that there's a neoplastic or cancerous process going on. So there's certain changes in the cells that the vet will also look for. So basically, after the fine needle aspirate was completed, the vet will have a good idea of what type of growth this is. Sometimes it's inconclusive, and in these cases, vet will normally decide to observe the lump unless he feels like it's better to maybe just remove it and have it assessed on a histopathological level. After making the fine needle aspirate, the vet will decide, okay, to take it further, we might have to send a biopsy for histopathology to a lab where they can, at a higher level, look at the cells and make a complete diagnosis as to exactly what type of growth it is. Sometimes a vet will decide to just take a punch biopsy or a little small biopsy and send that away. In other instances, your vet might decide to remove the whole growth and send it away. And in these cases, you've already taken the step of curing it, and you're getting a diagnosis in the same breath. So this is a step that I normally do to take, unless you are uncertain of the nature of the lump and you just want to take a biopsy first and see what it is before going into larger surgery. So after this step, and you have probably made a diagnosis now, and the vet will decide, do we have to look further for possible spread of this growth? And now I'm talking only about the cases where malignant or cancerous growth has been diagnosed. Then the dog will need to undergo further exams if the vet feels it's necessary, just to check if it hasn't spread somewhere else in the body where it's not visible. In these cases, your vet might suggest that x-rays were taken. So you'll take radiographs from the chest, on the abdominal cavity, depending on what type of growth he has identified earlier, just to see if there's possible spread to the internal organs. And other thing that the vet could maybe do is do an ultrasound scan of your dog's internal organs, your liver, the spleen, and the kidneys, etc., just to make sure that there's no spread that you also need to be aware of. So after this has been done, a decision needs to be made on what route to take to treat the growth. In most cases, if the growth is on the skin, your vet will suggest that it be removed by a surgical procedure. If it's a benign growth, so it's not something that is life-threatening, there's a few factors that will be considered first of all. So your vet will ask, does it bother your dog? Is the dog licking it? Is it scratching it? Is it biting the growth? Is it painful when you touch it or sensitive? Does it start bleeding or ulcerate? Is it bothering you? And then taking all these factors into consideration, your vet will decide, is it needed to remove the growth, or is it something that can just be monitored and rather left untreated? Especially in older dogs. You don't want to put them through surgery and anesthetic unnecessarily if it's something that's never going to bother a dog. If it's just a wart, something benign that's just going to sit there and doesn't really play any role in the animal's health. If it is malignant, if it's a cancerous growth, then there are certain things to consider. Again, surgical removal is the easiest, quickest way. If it is on the skin, that is probably the step that the vet would advise. And in these procedures, the dog will be sedated and the site will be prepped and the growth will be removed with a clear skin margin all around the growth to ensure that most of the cancerous cells are removed. Now I'm saying most of because this is a macroscopical treatment option. It's not on the microscopical level. So unfortunately, in some of these cases, at a later stage, there might be a resurfacing of this growth in the same location or in a different location because some of these cancerous cells might escape on a microscopical level or might have already traveled outside the margin where it's visible for the vet to see and remove the growth. So just keep that in mind, that surgery is your quickest, sometimes effective way to treat and the way that makes most sense to animal owners, but there is always a chance that the growth might return at a later stage depending on the malignancy or how aggressive the lump was in the first place. Other options that can be considered, and this all depends on your practice, on the financial situation, on the type of growth, on the age of the animal, is things like chemotherapy and radiation, which is also something that's a lot more commonly used in people, but it is available for treatment in dogs as well. In certain sad cases, your vet might decide to treat palliatively or basically just symptomatically. These are cases where the animal is a high risk for surgery. If these growths has already spread to a point where it doesn't make sense to try and remove it, the location of the lump, the infiltration into surrounding tissues, if it's spread to the lungs or internal organs, a lot of these factors might play a role, and the vet might decide that it's better to leave the cancer untreated. And this is also something that's normally then putting a limit on the lifespan of an animal, sadly, but there is cases where this needs to be the decision, where surgical procedures will just cause more harm than good, or it would be just basically impossible to remove all the cancer. So yeah, this is basically the process that a vet will go through when you present your dog for lumps and bumps. So its most important thing is, first of all, if there's any lumps and bumps on your animal, if they appear rapidly, suddenly, they grow quickly, they bother the dog, please have your dog checked out by your vet. Make sure that it's nothing aggressive or can cause any harm to your animal. I think that is basically it for today. If there's any questions, please remember that there is a section on the website where you can submit questions or even topics that you want us to discuss. So please make use of this function. Until next time, goodbye and thank you for tuning in.
For more information, visit our websites dogtalk360.co.za and georgevet.co.za. Also follow and subscribe to our social media platforms for DogTalk360 and George Animal Hospital. DogTalk360. Best advice, best training, better dogs.